So welcome everyone. Before we begin, I would like to acknowledge the land on which this webinar is being hosted. CIPHER is housed at the University of Regina, located on Treaty 4 and Treaty 6 territories, the ancestral lands of the Cree, Saulteaux, Dakota, Lakota, and Nakota nations, and the homeland of the Métis. Please join us in considering how we can each in our own way move forward in a spirit of reconciliation and collaboration. So a few notes of housekeeping. All attendees are in listen mode only, so as to limit background noise, attendee cameras are also off. Today's session is being recorded. A link to view the recording will be automatically sent to your email address. There will be time for questions at the end of the session. Please type your questions in the question box anytime throughout the webinar. So to access the real-time English captioning of this webinar, please use the link in the chat to be directed to Wordly, a translation and captioning service. Please be sure to keep the Wordly window open and select English at the top of your window. Alors, pour accéder aux sous-titres anglais en temps réel, veuillez utiliser le lien fourni dans la partie clavardage qui vous redirigera vers Wordly, un service de traduction et de sous-titrage. Assurez-vous de garder la fenêtre Wordly ouverte et de choisir English en haut de votre fenêtre. I'm so pleased to welcome our speakers, Dr. Sandra Moll, Nadine Leduc, Melissa Parker, and Saliha Ansari, who will be presenting new frontiers in app-based support for public and safety personnel and healthcare workers. So today we will learn more about Beyond Silence and then PeerOnCall. So thank you so much, and let's get started.
Hello. Thank you so much for the opportunity to be here today. Over the past 2 years, it's been a real privilege actually to be leading 2 really exciting projects that I think represent new ways of thinking about mobile health technology and how this can be a tool to help support workplace mental health. So I'm going to first of all talk about Beyond Silence and then move to PeerOnCall, and I have my colleagues presenting with me. So if we want to go to the presenter slide, I guess, first of all, express my sincere gratitude to the Public Health Agency of Canada, who funded both the Beyond Silence and PeerOnCall projects, and this work would not have been done without that funding. At this time, the mobile health applications are only available to participants in the research. We are working on sustainability planning, and there may down the road be future commercialization. Okay, so Beyond Silence, this has really been part of my program of research over the last 15 years or so, really thinking about how do we promote earlier intervention and support for frontline healthcare workers, and how do we move beyond the stigma and silence, which is kind of the name Beyond Silence. Next slide. Just a picture of our small but mighty team at McMaster. Salia and Melissa are going to be presenting with me today. And we also have an advisory team and knowledge users that bring expertise in trauma-informed care and workplace mental health and mobile health innovation and deep connections in the healthcare community. So why are we doing this work? I think if you look at the newspapers, you will see that the healthcare system is in crisis on many, many levels. This is a time when there's been unprecedented workload pressures. There's been many people off sick, people leaving the profession. There's been reports of moral injury and stressors associated with the pandemic that doesn't seem to go away. There is a really urgent need for accessible mental health supports for frontline healthcare workers. There's many challenges in the system, and a mobile health is not going to fix all of those, but it is a tool to be able to enable people to get the services that they need in a timely way. And that, again, mobile health technology has the advantage of having something accessible on demand in your pocket, private, secure. So our study objectives, next slide, are to evaluate the implementation and impact of a new peer support app that's been designed by and for Canadian healthcare workers, and to study this over a 6-month trial within 4 to 6 case study healthcare sites. Next slide, please. Yeah. I'm going to turn it over to Salia, who I think is going to walk you through some of the Beyond Silence features.
Yeah, thank you, Sandra. All right, so beginning with some of the features, we have multiple screenshots here, and I'll just walk you through each one. So beginning with the first feature, we do have, so once you download the Beyond Silence app, you can put in a unique clinic code. So if your organization is participating with Beyond Silence, you would put in the code and you would have access to your entire organization. Now, what this does for you is that you have access to the different resources that your organization has posted, any customized articles or content, as well as for some internal peer support providers who can provide you support. So the second screenshot is more so about our main feature, which is peer support. Now, peer support allows for an immediate connection with a trained peer support provider via text or call. And these are 30-minute appointments. As you can see in the screenshot, it says, for example, under Amanda R, it says 2:30 p.m. EDT or EST, and then 3 p.m. So you can book those immediate slots within for example, a week before or even 10 minutes before. So it's immediate support. And then the last two screenshots are some of the, well, an overview of what our Explore section looks like. So we have local resources as well as content overall. So we have things spanning from articles to videos, podcasts, and these can be on topics of, for example, trauma self-screening, as you can see on the screen, as well as burnout, different topics. All right, next slide. Right, so as I mentioned, okay, thank you. So the first screenshot on this slide is the wellness check. Over here, there is a sliding scale, which you can see kind of in the middle of the screen, moving from I'm well to in crisis, and it monitors individual wellness over time based on what you select. So this will populate over time. You can also see that at the bottom, there are temperatures and then the dates right underneath. So you can track it. You can look back at how you were feeling last month, for example, or maybe a week ago. Moving on to the second screenshot, that is the chat, or sorry, that is the check-in. So this is populated based on some of the prompts at the bottom of the screen. So you'll be asked, how are you doing? And then you can click some of the other prompts below. This allows you to kind of see some of the resources available, which are in the third screenshot. For example, if you select some of the prompts, it may refer you to articles under down. For example, you are not alone, or suffering and loss. And then the last screenshot is goals. So you can set goals within the app. And these goals allow you to improve as well as achieve some of your mental health goals. And then there are achievement badges within the app itself. All right, next slide. So as we talked about before, the main feature of the app is app-based peer support. We do have coverage from 8 a.m. to 11 p.m. EST, all 7 days of the week, and there are 2 peers per shift. And this is across organizations. We do have internal peer support providers as well as external. And then there is the option to connect via both phone and chat. So you can call in and speak directly to your peer support provider via call, or you can just chat like a text-based system. So this is all appointment-based, and then you can also choose who your peer support provider is. So in the third screenshot on the right, you can see that there's a profile picture, the name of your provider, as well as their bio, and you can also select for different tags. For example, if you have a preference for gender, if you have a preference for language, like English or French, as well as clinical or non-clinical worker as some of the options. All right, next slide. So there are options for feedback within the app. So the first screenshot is more so for peer support providers. Providers can complete a post-call report. There are 6 different sections within this report. You can fill in if the client attended or not, the topics discussed, different recommendations and support you may have provided, as well as if you as a provider require support yourself, you can go in and click yes or no, and then the Beyond Silence team would reach back to the provider just to touch base, see how they're doing as well. And then there's also options for the client or the app user who just had the call or the chat to provide anonymous and confidential feedback after their session, so they can kind of rate how their call or chat went and then write down some feedback. And then the Beyond Silence team can see this on the back end, and then we can use this to build the app better, as well as training and things like that. All right, I believe I am passing it on to Melissa.
Thanks, Salaha. I will just quickly take you all through some of our research. So in terms of methods, we recruited, I think we ended up recruiting 7 diverse healthcare organizations. And essentially, we did specific implementation planning within these organizations to help decipher what works for whom in what settings. We've done training of internal and external peer support providers. And then we did a 6-month trial of the app in each organization. So we looked at things like app utilization metrics. We conducted champion interviews with leaders in each organization. We've done focus groups with peer support providers. And we also have looked at the in-app surveys that Salaha was talking about. Next slide, please. Sorry, just go back one. Thank you. So building the peer support community involves several steps. First, we developed the training curriculum in English and French with our partners at Homewood Health. Next, we conducted a nationwide recruitment of peer support that involved application and screening, and those who were selected enrolled into the 3-day training which was offered. We ended up reducing the training down to 2 days based on feedback. Graduates of this training sign up for weekly shifts and provide peer support through the Beyond Silence app. Monthly ongoing training and community of practice sessions are also offered to the peers, in addition to one-on-one consultations with the peer support coordinator. So essentially, these are our sites. We looked for a diverse range of healthcare organizations, diverse in both size, location, and the roles that are the roles of the healthcare workers. So we are approaching 1,000 downloads, and we are really pushing to try and get 1,000 downloads before our research trial is ending. You can see that the download rate varies across organizations. It's very low in some, moderate in others, and it's similar to EAP uptake we've heard. Some of this reflects the size of the organization, but also the onboarding strategies, and our focus has been on understanding and unpacking these implementation strategies. So this graph speaks to the implementation strategies across the different organizations we've done. You can see that when we've done an on-site launch, this does affect the uptake of the app. So essentially, our team goes on-site to distribute swag, to promote the app, and to answer any questions that people may have. This graph speaks to the implementation strategies across the different organizations as well. You can see in blue are the on-site visits, and push notifications from our team can be displayed by the yellow. So essentially, we have the ability to send a push notification to app users, and we do this times when there's new content or when there's new webinars available, and it allows us to track the different implementation strategies. When onboarding, there's an option to answer basic demographic questions. This is entirely optional, but if you look at some of the findings here, it's used across all age groups. The gender is predominantly women, which is not surprising since this is the trend in healthcare. There's a range of experience of our app users, not just new clinicians, but those with many years of experience. The majority are in a clinical role, but there are some non-clinical as well. This is just brief app utilization trends, looking at some of the goals set, some of the wellness check-ins, some of the different types of contents that is viewed. And as you can see, we are rapidly approaching 1,000 downloads. So for peer support outreach, we've had about 66 peer support appointments since we launched in November of 22. 74% were phone calls and 26 were chat-based. So approximately 35% were canceled or missed appointments, and we have heard recently that this is in line with standard EAP. Presenting issues can range from personal, work, family life, and we do collect this information at the end of a peer support appointment, totally optional, but it's provided by our peer support providers. Some of the support provided have been to listen, validate, and to refer to resources, can refer to guided meditation. We can recommend you out to your EAP and recommend a range of online mental health resources. So we've conducted 7 focus groups after 3 months of implementation with some of our external peer support providers. These are the providers that we've trained. There's been 25 focus group participants, and key messages have been about the value of peer support in healthcare, as well as ideas for promoting engagement among the frontline workers. We'd like to try and play a video here for you from one of our peer support providers.
Yeah, we are not hearing that. Sorry. It's too bad because it's a lovely video of talking about why you might reach out for peer support and the value of that. Really, as a healthcare worker, someone who gets a little bit of what the day-to-day work is like and the implications of that. I don't think anyone can hear that, can they?
No, unfortunately, the sound doesn't work.
It's too bad.
Okay, we'll just skip to the next slide then. So this video talks about the value of app-based peer support and how it reduces barriers to seeking help by providing accessible, customized, private and secure, and on-demand information and support. One nice highlight from this video, she mentions that help is just a click away and that you are not alone. There's others out there as well. I will pass it back to Sandra now.
It is somehow ironic that we built a peer support app and it's always about the technology that's a challenge. So apologies that you can't hear those videos. You know, one of the things that we found is that peer support is fairly new in healthcare, and so those videos have been really powerful in terms of really speaking from the heart, I think, from our peer supporters who understand why peer support is so valuable. So I'm going to talk a little bit about some of the organizational champion interviews. So with each organization, we do a baseline and we do follow-up interviews with the champions who are really leading the implementation in those organizations. So we've done 16 baseline interviews and we're just in the process now of doing the follow-up interviews. And one of the things, I'm not sure if you're familiar, but there's this framework called the Consolidated Framework for Implementation Research, or CIPHER. And it's really interesting because it really speaks to, you know, why an innovation may or may not be taken up in an organization. And so they talk about 5 different constructs. So one could be the innovation itself. So, you know, how is it designed, the complexity, what do people think of the actual innovation that you're bringing forward? But some of it is around the outer setting. So what is the context for implementation? So it could be in healthcare right now, COVID has had a big impact. There's been the climate of the problems in healthcare right now. It's really created a time when this is really valuable. So the outer setting has really created, I guess, a readiness for doing something different. Inner setting is actually the workplace itself. So it could be the work infrastructure, the technology infrastructure, the peer support infrastructure, the culture, the values, the alignment with the mission of the organization. Also the individuals. So, you know, who are the champions that come forward to do this? Characteristics of the peer support providers, is there leadership engagement, and also characteristics of the app users. So we've heard a little bit about, you know, who may be most receptive to this, or is there groups that might be more resistant? And then the last piece is around the implementation process. So we're studying a little bit of what are the engagement strategies, where's the messaging, what is the messaging, who's providing the messaging, this idea of how that looks over time. So really starting to study if the uptake really changes depending on some of these different constructs. If we go to the next slide, I'm just going to give you a little bit of a snapshot to show you how this is useful. So if we think about the outer context, if you want to just click, I don't know who's running this slide. There we go. So this is really around what are the facilitators and barriers to uptake of this intervention. So the outer context, just this is a classic quote, seeing what's happened in healthcare magnified by the pandemic, the need is there. There's a very clear need right now to support our healthcare workers. And if you click again, I think there's a quote about the inner context. So interesting, right now, even though there's a need, there's also this sense that healthcare is so strained right now, actually introducing anything right now is really tough. It takes time, it takes work, it takes trust to introduce a program. So it's actually been a challenge in these organizations to find space and time when there's so many things going on. How do you introduce something new when people are feeling really burnt out, not really receptive to taking on new things? The next quote I love, it's about healthcare workers who are really good about looking after other people, not so good at looking after themselves. So part of it is really trying to do some mental health literacy training around, how do you know when you're struggling? Try to get earlier intervention and support, that you should take care of yourself. How do we break through, I think, some of the resistance for healthcare to actually take care of themselves? And the next quotes are about the app itself. So we have a lot of positive feedback about the app. It's really easy to use. People really like that it's designed by and for healthcare workers. And then the last piece is around the implementation process. So people are talking about, how do I capture people's imaginations? People are stressed, they've got lots of things coming at them. How do we engage people to say, hey, this might be a really cool resource that we could use? And that's why some of those videos that you couldn't hear were about really trying to make that value proposition clear, I think, for the frontline workers. And the other thing is it's a process. So, you may get people aware that the app is there, but how do we kind of spark curiosity and then bring people back again to that? So some of the learning to date, really we're finding that there's varied uptake and utilization depending on the organization. And part of this study, we intentionally chose some small, mid-sized and large organizations. We intentionally chose some rural, some urban, and we're trying to start to understand and unpack what are the best practices of implementation in different kinds of organizations so we can make some recommendations. One of the things we know is that the champion becomes important, or champions in the organization, and what is their role and how are they engaged? What are the processes for promotion and engagement? We've learned some really innovative strategies. One of the organizations, I think 56% of the people adopted that, and that was because they had a place where people came and talked about this, and the app was launched and we did things with them. How do we embed this technology into current processes for mental health support? So how do you naturally have times when you can talk to people? So, when a manager has someone in their office and they're really struggling, you say, hey, this is an extra resource for you. And we need multiple levels of engagement at the organization. So from top down, bottom up, and I say everything in between. And then the next piece, if you want to click again, in healthcare, peer support has been around for a long time, but not necessarily formal peer support. So this is a fairly new idea, and I'm going to talk about public safety, where I think it's much more established, but in healthcare, this is a somewhat new idea that you would actually reach out, make an appointment, you'd do that via an app. So it's going to take some time, I think, for people to understand and get used to this kind of a tool. The value proposition needs to be clear to the frontline worker. I think it's really clear for leaders, but for the frontline workers, what this will be for them. Digital literacy, I would say that the pandemic has made us a lot more literate. I can even figure out a QR code on my phone. So I think there's less of a barrier there, but certainly mental health literacy for getting people to recognize when they need to reach out. And we need ongoing sustained strategies for promotion. I think the last piece is kind of take-home messages. I think there's a lot of value in app-based peer support in a stepped model of care. So this is not going to resolve the problems of the system, but the idea is if we think about step model of care, we talk about the having the right service at the right place at the right time. So this is a fairly easy entry point. It gives people choice that I can just talk to a peer. I don't necessarily need counseling at this time, but I could down the road. So it could be a triage service. So thinking about where this fits in this stepped model of care or mental health supports for healthcare workers. If we can promote earlier intervention support, it may prevent a crisis down the road. We know a little bit, whoops, if you want to go back, sorry, about organizational readiness and the capacity to invest in implementation. It is not just a matter of saying, hey, here's an app, everybody. You need to really talk to people of what that means and what that looks like and how to integrate that into their lives. It's going to take some time to build a culture of peer support, and implementation and impact are interrelated. So instead of just saying, does the app work or not, it's really how is uptake shaped in different kinds of organizations. And we need time to track not only individual change, but is there impact at an organizational level? So there's continued work that needs to be done in this space. Okay, next slide. That's it for me. Our website is there if you want to connect with us. Our email is also there. And I think there's some references as well. And I do know that there are some questions in the chat. Marie-Christine, do you want me to address those really quickly?
We can, because they are specifically about Beyond Silence. So the first question was, I might have missed this, but what are the qualifications for being a peer support provider? And how do you ensure that those providing support are trained and knowledgeable and how to do so? I'm going to let you answer this question now. Yeah.
Yeah, so great question. So we advertised for peer supporters, and they had to be healthcare workers who had an interest in this. What we find are people that come forward are often really invested. In our training process, we actually do some screening in that training and in the ongoing follow-up sessions. So everyone who is accessible in the app has to have completed that peer support training that includes things about boundaries and managing risk and things like that. And will there be more trainings? We hope so. We're at the end of this project, but we're looking at the next phase of that. We have a fantastic group of peer supporters. It's been a huge success of this project. They're really committed, engaged group of people, and we would love to continue to add to that.
Maybe we can take the last question for Beyond Silence now, and then we're going to move on to the PeerOnCall presentation. So the last question we have is, will the Beyond Silence app be rolled out to organizations outside of healthcare eventually? I am part of a police service who already have a peer support program network that has been running for the past few years. Adding an app-based platform to augment our PSP would be amazing.
Okay, so that's a segue into the next presentation. We actually have a similar project. I think it will answer question number 4 as well. So, so we started with Beyond Silence, but then had an opportunity to be involved in building a similar product for the public safety community. So that's what I'm going to talk about now. So there is something specifically for police and for correctional services. So stay tuned. So this PeerOnCall, this is actually part of a project, a larger project funded through CIPHER and University of Regina to look at advancing peer support. And this project is done in partnership with researchers from a number of universities, including Western, Laurier, Memorial, the Marine Institute, and University of Regina. So it takes a village. And Nadine is here because she's part of that team. Calling in from Newfoundland, I love it. Our project goals were really to build capacity for peer support across 4 sectors. So corrections, emergency communications, paramedic, and fire services. And to deploy and evaluate this new PeerOnCall and PeerOnCall support apps in 20 to 30 public safety organizations across Canada. And just to give you a little bit of history, if you go to the next slide, this work has been since 2019. It's been 4 years of work. We started by, when you do app development, it's very much an iterative process. You want to go to the community, find out what people want. So we did lots of listening and focus groups of what is it you want in an app. what do you want it to look like, and then building prototypes, testing, getting back, and then going back again. So it's been this very user-centered design. It's best practices of mobile health development. And so we kind of were involved in peer support training. We actually launched version 2.0 of the app in the spring of this year and have been doing implementation research since then. And there's a picture of our team who's involved in this process. If you go to the next slide, I'm just going to quickly say that there's a number of design principles in this community. There's been lots of conversation about the need for privacy and security. It's been a big piece and a thread that's gone throughout our project. And people wanted something by and for that community, someone that really understands the issues in that community, and a trauma-informed approach. I'm going to keep going here. So what we, you go back. Whoa, there we go. Oh. Next slide. There we go. So what we built is actually what I call a mobile health platform. And the platform has three pieces. One is PeerOnCall. So this is the app for frontline workers. The second is PeerOnCall support. So this is the one for peer support providers. And then there's a portal, an administrative portal, where we can change and update the content and track the analytics. So if you go to the next slide, the different features, it's actually built on the Beyond Silence source code. So you'll see that they're the same kind of features, but the content is very much customized for the public safety community. There's, this feature of getting support via chatbot or exploring information. We built a library of resources specifically for the public safety community. So it includes over 70 peer wisdom videos, evidence-based articles, and the topics were ones that we heard from people as important. So things like managing a bad call or a bad shift, transitioning from work to home. There's a section around new recruits as well, because we know they can be a particular group that has needs. And then there's the same kind of thing as the wellness check and toolbox and goal setting. And if you go to the next slide, this I think shows you the connecting to peer support sort of user flow. In the Beyond Silence, it was appointment based. In the PeerOnCall, it's actually you would access your own peer support providers in your organization. It's not appointment based, it can be at any time. And it's text and or phone. When you reach out, you are completely anonymous. This is actually in both apps, that the peer supporters are known, but when the peer supporters get a call, they do not know who that person is. So they're completely anonymous. And then again, there's this feedback opportunity. So through this project, we had trained 104 new peer support providers via the project. And I really, really wanted to show you, these are these fantastic peer wisdom video clips. The first one here that you're not going to be able to hear, but I can just tell you, Dave McLennan, he's a retired police officer from Boots on the Ground, and I asked him to do a video for us that explains, how to talk to peer support. What happens when you call? What can you gain from that? It's a beautiful video. Another time and place. All of the videos are usually less than 30 seconds long, so they're really brief, but kind of give people an authentic. You can actually play it so you can see him talking, and I'll just sort of explain. It's a little bit of trying to reduce the mystery of reaching out for peer support.
You don't have to get into the details of any specific bad event, just tell them in general what's bothering you and start having a conversation. The biggest thing is reaching out, talking about what's bothering you. And once you get the conversation going, there's lots of options, things that can be done. There's solutions, and there's a lot of things that we can do. But hopefully you're going to leave feeling better and with resources to go forward and a strategy to go forward in the future.
And so we have similar video, well, they're all a little bit different from people in the different sectors. And the next one, we don't need to play it, but it's actually an audio clip from a paramedic who wanted to convey a message of hope to other people. And he really talks about, we get it. You're not alone. There is hope. You bring value to the paramedic profession. It's quite lovely. So again, these video clips of people talking to their peers about how to manage kind of different things, words of wisdom over time. Go to the next slide. So the other thing we built is a tool for the peer support providers. So peer support providers, many of them do this on the side of their desk. They're fantastic people. What we tried to build for them were tools to actually manage their own boundaries. So to turn on and off their availability, to block users if they need to, tools to manage people at risk, access to resources, as well as a really simple system for post-call reporting. Next slide. Again, the research that we've been doing, similar sources of information, and really we wanted to know not does the app work, but what works for whom and what context. So really trying to unpack that we know this may not be for everybody, but who would this be valuable for and in what context. Next slide. I want to leave us time for questions, so I'm whipping through this fairly quickly. We launched in May. We're currently implementing in 34 organizations across Canada. And you can see the numbers there. I should mention that we actually have a separate source of funding from the Movember Foundation. And through the Movember funding, we actually have been focusing on police and law enforcement services because they weren't included in this group. We also have implemented in more West. We also have a Quebec-based organization. I should mention that both apps are bilingual, so everything is in both English and in French. And you'll see most are Ontario and the Maritimes. That's because a lot of our connections are there, but there's certainly opportunity to expand. Outreach to peer support, this shows you by sector, the people who've downloaded the app, the kind of percentage of outreach to peer support so far, and the numbers there. And they're a little bit different across the different sectors. Next slide. We haven't had a lot of post-connection feedback surveys, but just to illustrate to you that we can start to look at what are some of the common presenting issues that people are calling in with and what kind of support is provided. So you get a sense of, are they work-related and kind of what kind of support people are seeking. Next slide. And this just shows you the wellness check-in features, sort of how much it's being used. It's interesting, different sectors, I think, will use different features. So in this one, the folks in comms are more likely to use this than percentage-wise than other sectors. Okay, I'm going to turn it to Nadine, and we're going to give you a little bit of a glimpse as to what's happening in each of the sectors in terms of the kinds of things that we're learning.
Thank you, Sandra. To begin with, communications. So this is a sector that's relatively small, and we're pleased to be able to build capacity in this sector for peer support in organizations that either didn't have peer support or didn't have it specific to communications. So we worked in partnership to develop a peer support program that was specifically designed for communicators. And for that, we're able to provide about 50 communicators peer support training. And now, while this sector only has 118 employees in this test, it is relatively low in comparison to the other sectors, but we do have the highest rate of downloads. And that speaks to what we believe is that the organizational champions are invested, they're motivated, and they're continually motivating the communicators in their center to use the app, not just for peer support, but for all of the other features that are available. Next slide. What we learned from our follow-up interviews with the communicators is that they responded positively to the app. This group often feels overlooked and that their mental health concerns are dismissed. And so they appreciated being included in the app, but not just included, but recognized as a unique group. And much like other public safety sectors, stigma remains rooted in communications center, partially because of a limited understanding of secondary trauma and its impact, but also sometimes a lack of understanding that communicators are exposed to potentially psychologically traumatic events as a function of their job every day. And then the third sort of ties up to the first piece is that this group do commonly feel forgotten about, and their critical contributions, they feel, go unnoticed. And so with this app designed, their piece of the app designed specifically for them and their peer support again, designed specifically for them, led to them sharing that they felt valued in this study. And then the next slide. And for corrections, so we have 2 provinces here in out here in Newfoundland, Labrador, as well as in New Brunswick. And the Newfoundland group started May of last year. Now, they have a specific, they have some challenges. So morale is incredibly low, particularly out here in St. John's at His Majesty's Penitentiary, where the physical conditions of the prison are particularly challenging. You know, it's in all of the news reports that there are, you know, rats, mold, poor air quality. So the environment, I mean, the correctional environment is difficult to begin with, but adding these layers as well as overstaffed, forced overtime, and not getting vacation time off, it's really a difficult place right now to try to get this group motivated to use an app. It's also been difficult to schedule up follow-up interviews with this group just because they're maxed. This is a high needs, high stress group, but it is difficult to be innovative when you're in survival mode. And while we look at the New Brunswick numbers, they may be smaller in comparison, but they're just at the beginning, the initial phase of implementation. And so, next slide. What we learned here, again, this is a high needs, high stress group, and they appreciate the support from peers who understand their environment. So it's difficult sometimes for public safety personnel to reach out for help and then have to explain a situation before being able to receive that help, which is why peer support in this group is so critical, that somebody already gets it. And they were very appreciative of that. Where they felt there might be an issue is that word travels quickly throughout an institution or throughout multiple institutions within a province. And so although the app is, you know, confidential in its design, they don't believe that they can truly stay anonymous when using the app in such a small environment. They also noticed that there was a generational divide between those who do see the app as an option for support and those who don't, and that will take time to change. That culture will take time to change. And then Sandra, if you want to continue with FIRE, I believe.
Yeah, I'm seeing all the great questions in the chat, so I'm going to try to speed us through this so we can get to your questions. So in the fire services, this has been a group, I said it's taken off like wildfire. We get questions every day from fire services asking for the code. We're currently implementing in 9 fire services and some more to come. And if you look here, again, intentional thinking about including volunteer fire services. I think most of them are small volunteer fire services ranging between 12 people. I think we have one large 1,500 person organization, but most of them are 5 are small, under 40 people, 3 are mid-size, 1 large. And you'll see, again, the uptake is a little bit different. This 100% is an organization that only has 12 people. The 7% they just launched, and they're the 1,500 people. So again, a real range of download rates. Next slide. There's lots and lots of information. By this way, the pictures in the top right are the group that is actually doing the implementation. So you may recognize Joy, Margaret, and Robin from FireWell, who are leading the fire service implementation. So a couple of things I wanted to pass along. There's lots of conversation about the value of the app, people being really excited, having something particularly for both paid but also volunteer fire service, and liking the anonymity option. One of the significant barriers is really around resources. So even though the app was free and we supported implementation, they recognize that it takes time. And may not have the budget funds to move ahead. So again, needing time and getting people to buy in will take lots of work and effort to do that. Next slide. Paramedic services. Again, we're implementing in 9 paramedic organizations. And again, I think there's a mix between, I think there's a couple of small, 6 mid-size, 1 large organization. And again, variation right now in terms of implementation and uptake across those organizations. And this is a little bit what we're studying, right? What makes a difference in terms of uptake and implementation in these different kinds of organizations. And next slide, in terms of some of the key messages that we're hearing, again, we're at the beginning of the process, but this idea of anonymity, breaking down barriers and seeking help, and things that may affect adoption and usage. It's interesting, you know, a number of these services have established peer support that's in person. So it's really thinking about when in person versus when do I use technology. And I think one of the questions in the chat is, you know, there's an absolute place for in person and there's a place for technology mediated. And we have to think about how they might coexist and how might different things work for different people. And then certainly some things about, we hear this in a lot of places about generational differences, about who might take it up. With the newbies being more open, more tech savvy, more open to talking about mental health issues, where it might be more difficult if people are well established, they don't have a cell phone, they're not comfortable with a cell phone, that kind of thing. Next slide. So some of the things that we're starting to hear, I feel like we're beginning to learn about what works for whom and what context. Overall, there's been lots of positive responses to the app and this idea that we need app-based peer support. People like it, it's user-friendly. We hear that privacy and data security are primary concerns. There's still a lot of stigma. Nadine's example from corrections, even though the app, you don't know who they are, they figure by, if I talk to someone, everybody knows everybody else's business, so they're gonna know who I am. So even though the app is anonymous, it's not necessarily anonymous because people might try to figure out who I am still. And I'll talk about implications because I think there's maybe some need to think nationally about peer support. It's not just your own. Right now, the app is only implemented in organizations that have their own peer support service and they only access their own peer supporters. We need resources to build capacity. This is a group that can do a lot of really fantastic work, but need resources to support what they're doing. And again, we've been trying to think about how do we build resources for them. Implementation, we need to understand the unique workplace culture and time to secure trust and support for implementation at all levels of the organization. We certainly hear there's buy-in in some places, not others, and it makes a difference in terms of implementation and uptake. And the last piece I have is around recommendations. So next slide. One is to build peer support infrastructure within and outside the organizations. We have tried this in a few places where organizations have shared their peer support providers. So if you think about it, if there's a wildfire in Northern Alberta, their peer supporters are also immersed in that. It would be really lovely to be able to access someone in Newfoundland where they're not going through the same thing. So there's, I think, a real movement. Can we build a national peer support service where you have options of linking within or outside your organization? Lots of conversation. When is it available across Canada? Who can get it? We really want to make sure that we make it accessible, low or no cost to those who need it. We are working very hard to try to find a stable funding and distribution model. We've had fantastic support right now, but I know our research funding is coming to an end, so we're trying to look at what is next. We have got lots of momentum. How do we continue to build trust and sustain momentum and account for sector-specific needs in future implementation? There's certainly some commonalities across sectors, but there's definitely some uniqueness, which I hope you've heard about today. So I think as we start to think going forward about building resources, what does it look like in the different sectors and their needs? And I think that's it. I think the last slide, I think there's references, but also our website and how to contact us. And I understand that I actually had the wrong email address for Beyond Silence. So I don't know if we can pop that in the chat or correct. I think you can find it if you go on our website. All right, I'll pause there so we can get to some of the questions.
Thank you so much to both of you. Thank you, Dr. Sandra Moll, and thank you, Nadine Leduc, for this presentation. We have many questions. I'm going to let you go through the questions and answer them. So we can start quickly with, I have question 5 here. I'm interested on your insights on working with the notion that frontline workers are aware of when they are in need of support and able or willing to reach out.
Yes, so one of the reasons we built this app is thinking about mental health literacy. So mental health literacy is knowing when. So a number of the Peer Wisdom videos in the PeerOnCall app, for example, are how do I know? There's this fantastic firefighter who says, you know, I knew when I was angry with everybody and everything, that's when I knew I needed to get help. So I think we need more kind of people talking about cues as to how to know when you need help and then where to go, right? And what you can do. So happy to chat afterwards. I can put my email address in the, can I put it in the chat? If people want to ask about that, this is a big piece for me, is that mental health literacy. Should I just go through and pick questions here? Should I go them in order?
Yeah, I think we're going to have to pick because we only have 2 minutes left.
Yes, there's EMS representation. Yeah, so there's a lot of questions about access. So who has access? So email us if you're interested. We're trying to make a case that there is a need to continue this. So let us know, reach out to us. Suicide rates, sorry, this is chatting. Yes, we train, all peer supporters must have training in suicide risk assessment. And we have a protocol in the app for managing people who are at risk of harming themselves or others. And I'd be happy to chat about that at another time. I'm trying to get through as many as possible here. When it will be more broadly open, stay tuned. Having supervisors or managers resort to, there's an app for that. Yeah, an app is it's only a tool for communication. It's not going to fix things. It's one tool in the toolbox, I think, about how to make it easy for people to reach out to someone that really understands. So, oh, there's the corrected address, great. Federal corrections, we're not there yet. We've only been in provincial. Oh my gosh. Are there other ones? Sorry, it jumps for me when I start to read them. Oh, police organization. Yeah, so we do not, in PeerOnCall, we do not, we're model agnostic. So it's people accessing the peer supporters in their own organization, and they must have some kind of training and ongoing support system, but really the app is a platform for you to be able to access your own peer support service at this point in time. The vision would be to have a national peer support service that people could access. Similar to what we've done in Beyond Silence, we actually have this community of practice. We do ongoing training and support. I would love to have that happen in the public safety community as well. And I know this grant was part of a larger group thinking about peer support training guidelines nationally. And you will be hearing things in the next few months, I think, about what's happening with that project.
So maybe we can answer this last question. When you say low to no cost, is that referencing no cost to the organization with an established peer team, large scale organization?
So I know there's questions about sustainability. It is not inexpensive to continue to provide a service. I thought building it costs money, actually continuing it costs money. So we're trying to figure out how to make it accessible. We're looking at a number of different sustainability models so that people can get to it. And so if anybody has any ideas about who might be willing to sponsor or fund, please tell us. We're trying to think about how we get money from a range of sources, because really the vision is to get this to people who need it. So again, please just stay in touch with us. Let us know if you're interested. We're going to make a list of people that have expressed interest, and that's our next step. That keeps me up at night, is what's the next phase going to be. So we have some ideas. We haven't finalized that yet, but hopefully we'll know in the next month or couple months.
Thank you so much. Thank you to Dr. Sandra Moll, Nadine Leduc, Melissa Parker, and Saliha Ansari for such a wonderful and engaging session today. Our thanks also to all who attended, and I hope that you will join us for the next CIPHER webinar in February, showcasing the Healthcare Salute project. So thank you so much, everyone. Have a nice day. Bye.